Greetings, guys. So today I have the pleasure of having a conversation with Dr. Saint Amour. He's an emergency medicine doctor here in Virginia, and I'll let him do a brief introduction on who he is.
Excellent. So I did a residency in Chicago and quickly moved back to Michigan and loved the teaching aspect. So I became the student coordinator and then the associate program director. And then I was offered a position to start my own residency there in Michigan and loved that. Then I moved out here to Virginia and started another one. And so that I've been teaching for quite a long time.
Right. And well, I know you said you were a program director for some time, especially here in Virginia at LewisGayle, right?
Yep. Mhm.
Yeah. So the first question I have, and I'm sure a lot of people would be curious to know this, is from a program director's standpoint, what are
Mhm.
some of the things you look for in an applicant?
Gotcha. So in general, applicants is kind of like it's not a bell curve, it's a spike.
Okay.
And so it's hard to tease apart who are the better applicants and who are not. And again, when I look at applicants, I don't look at who is the best applicant. I look at who is the best for me. Like, what do I lack in my program right now? Or what maybe, I have a lot of people with a specific background, but I don't want everyone with the same background. So I want people with differences.
Mm.
And so I look at it not comparing apples to apples, but more fruit baskets to fruit baskets. And so,
All right. So like a diversity of skill sets to
yeah,
round the program out.
yeah, backgrounds, skill sets, because everybody's going to learn from each other. That's the goal is that, yeah, that everybody's learning all different things, even life things. You have some
Right.
older and some younger,
Mm,
different ethnicities,
mm,
different backgrounds.
mm.
Maybe some were nurses before. Maybe some went straight through. Maybe some had prior careers, things like that. That the more you can mix it up,
Right.
um, the better the
Okay.
soup tastes.
Okay.
The more stuff that's in there. So
That's interesting because there's a lot of older applicants that would ask us like because they're older graduates, if
mhm.
that would lessen their chance of matching. But based on what you're saying, there might be certain circumstances where that would help.
Right.
Okay.
And I guess it depends on the residency too. Like if you're an older um, applicant, some things that are going to be very challenging might be a drawback, such as I think about like surgery.
Hmm.
That's a long residency and it's very physically demanding,
Right.
and so that may be a drawback there. But in emergency medicine, because we deal with people from all different stripes of life all the time, the more diversity and flavor we can learn from each other, the better.
Okay. And what are some traits? I know you said diversity is important, but what are some specific traits that you tended to look for that, did well in your programs?
Gotcha. So some of these are specific to emergency medicine,
Hmm.
such as the ability to stay calm when things start getting crazy. Um, the ability to communicate clearly is always huge, especially under pressure to still communicate well. I did have one resident that when he got stressed, he reverted and started speaking Mandarin.
Mm.
That didn't help. It didn't help anything.
Right, right,
So,
right.
um,
Hmm.
so, yeah, the ability to communicate clearly, knowing your limits, knowing what you're good at, knowing what you're not good at,
Right.
and knowing that you're going to learn, you're going to grow. But if you already know everything, then you don't need to be in residency,
Right. Okay. So now it's interviews, well, coming up to interview season.
right? Hmm.
A lot of people are nervous about going into their first sets of interviews. What are some of the, well, I'll ask it in two ways. The first way I'll ask it is, what are some of the things you looked for when you were interviewing applicants?
Gotcha. So I looked at the applications as like a date of this
Mm,
3-year marriage that we're going to have,
okay.
right? So it's a date, it's the first step.
Mm,
And so people would apply through ERAS, and what a lot of applicants don't know is that if you don't meet the cutoffs that have been set by each program, we never even get your application.
mm,
So if it says you have to have a certain number of letters of recommendation or things like that, you have to have your board scores in. If you don't have them, I never even see the
right.
application.
You said there was a filter that automatically removes
Right.
it. Yeah.
Automatically, they're off the board until you get all those things in, in which case the system then forwards it to
Mm,
us to review. So that's the first thing is if a program says that these are the requirements, there's no going around that. It
mm,
really is the requirements.
right.
Um, and then when they come in, there's certain things that I'll look at, and each program director is going to be a little bit different as to things that they think are important.
Hmm.
Um, for me, if someone was a scribe before,
Mm,
that held pretty good weight with me. If
Mm-hmm.
someone was a nurse,
Right.
that held pretty good weight with me because they know how the hospital works. They're going to have a
Right.
leg up in
Right.
that way. Um, Other things, obviously board scores are important because
Mm-hmm.
board scores show me that you know how to take a test.
Right.
And so program directors are judged by their first time pass rate of their
Of step
resident.
three. Mm, of
Right.
step three.
So
Mm-hmm.
I've actually
Oh,
the
the
state
board
one, right?
exams.
Yeah.
Right. 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 Mm,
So
okay.
so if their first time pass rate is not great, you're going to be looking for a new job. You're going to get
Mm,
fired. And so if you take people knowing that maybe they're not the best test takers, you're kind of putting your neck out there to maybe get chopped up.
mm, okay.
Um,
Okay. And that's why step scores are so
that's why
important for
steps are
them.
great.
Okay.
Not that we think that the information on the steps is pretty close to useless. Like
Mm,
all it shows is you know how to learn, you know how to take a test.
right.
It's not going to teach you anything about judgment or medicine,
Mm-hmm.
but it shows me that you know how to take a
Mm-hmm.
test.
Right. Right.
So,
And if you could take a test, you more likely to pass the board on the first try, and that's
yep,
your job security.
exactly.
So yeah, so we're coming up on interview season. A lot of people are asking, how they should approach answering questions in interviews, how to prepare, those kind of things.
Gotcha.
What are some of the things that you looked for when you were interviewing an applicant
Hmm.
specifically? Yeah.
Perfect, perfect.
Mm-hmm.
So one of the things I want to do is before somebody comes to interview, uh, I've already gone over their information. So I don't really need to ask them any factual questions unless
Right.
I completely was not paying attention. I might ask questions about their personal statement if it was interesting, if something stuck out to me about that.
Right.
Sometimes if something seems a little unbelievable,
Mm-hmm.
I might do a little fact finding and see if it actually
If it
was
was actually
believable
true.
or if
Right.
they're
Right.
completely just
Right.
making it
Like
up.
if it's like a medical story
Or even something in life.
right.
Um,
Mm-hmm.
I've heard of some program directors handing someone a guitar and saying, "Well, it says you know how to play
Right.
it, so play it."
Wow. Wow.
So don't. The name of the story is don't put anything on your application that you can't back up,
Right.
or if it's untrue, don't put it on there.
Right.
It
Right.
will come
You
to
could
light.
get exposed.
Um,
Mm-hmm.
I personally like an interview style where I can pull out the characteristics that I'm specifically looking for.
Right.
So if I want to see how you deal under stress, I'm going to put you under stress.
Right.
Not to be mean,
Yeah.
but I want to see how you handle it in real life.
Right. Right.
Um, so some program directors will ask more, how do you handle stress? They'll just ask
Yeah.
questions like that. And I think
Yeah.
that's a little more boring.
Yeah. 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 You want to see how? Yeah.
So
Right.
we see so many people in interviews. Couple things. It's hard to keep people straight. I'm glad that we had pictures because otherwise we just can't remember who was who.
Because there's too
We have
many.
so many. We
Yeah.
interview hundreds of people. And then if everyone gives the same answer,
Mm.
again, it doesn't stand
Yeah.
out. So the goal is to stand out in a good way.
Yeah.
And so
Mm.
being very real
Right.
um,
Mm.
is that's probably the best way. Is if you can be real in a good way, that tells me that you would pass what we call the 2 o'clock um, test.
Mm.
And it's 2 o'clock in the morning, and there's nobody in the ER, and
Mm-hmm.
I'm bored to death, sitting beside you.
Mm.
Are we going to be able to talk and have a good conversation, and it's going to be interesting?
Right. Right.
Um,
Like
the
the
other thing
cool
is
test, basically.
right,
Like are you
right.
cool there?
The other half of that is at 2 o'clock in the morning when we're getting slammed in the ER is like on fire.
Mm-hmm.
Can I rely on you to working your hardest and doing your best?
Mm. Okay.
So, um,
Mm.
so also with the interviews,
Mm-hmm.
I would give my residents quite a bit of say because what I want is I want someone that mixes with the group of residents I already have. I don't
Mm.
want someone that's a complete outlier that really doesn't maybe get along good or just doesn't seem to mesh. I
Right.
want the residents to mesh because how you mesh is going to uh, help you with just like your personal
Yeah.
life.
Right.
And
And
residents
surviving
are hard enough.
residency.
You
Yeah.
don't need
Mm.
any extra stress
Right.
from I
Right.
feel like I don't fit in kind of thing.
Right, right, right. Okay. Okay. All right. Next question. So with personal statements, I feel like people stress a lot about personal statements. We were having a conversation previously, and you were telling me that it doesn't really come into play until you're actually,
Right.
applying, gonna get interviewed. But yeah, yeah, speak a little
Right.
bit about that. Yeah.
So generally, again, we have so many applications to read that we wouldn't even read the personal statements unless you're invited to an interview, which
Hmm.
we do.
Right.
And I would have one of the residents designated to come up with good questions specifically for people's personal statements.
Okay.
And the personal statements are, it's hard because people seems like they only write about one of three things,
Right.
which is a overseas mission trip that they took, the first time they were in a code, or taking care of a sick relative. So if you can write about something not one of those, that would be phenomenal,
Right.
because everybody seems to write on the same theme. And the goal is not to tell me about medicine. I know about medicine. I don't know about you. And that's what I want to learn is, like, who are you? What are you all about? What
Right.
makes you tick?
Right.
And if you can get that across to me in an interesting way, all the better.
Right.
That's
Right.
so much more fun.
Right. Okay. So I guess what I'm getting from you so far is like standing out is probably a
Standing
big
out, yeah.
part of
And it's hard because
mhm.
everybody's trying to stand out. So
Yeah.
what that does is it makes it so really not that many people are standing out.
Because everybody ends up standing out in similar ways, kind of
Mhm.
thing, yeah. Because they write about the similar things.
Yeah,
Yeah.
Unfortunately,
Yeah.
common things are common. And when I look back at the people that interviewed really well, most of them, they practice answering questions. They kind of practice interviewing. They got comfortable answering questions. They didn't mind controlling the tempo. So in
Yeah.
an interview, the way this works is, I'm going to ask you a question and you're going to answer it. I'm going to ask you a question, you're going to answer it. We're going to kind of like playing ping pong back and forth. And so the tempo can speed up. I can intentionally speed up the tempo, and it's going to make you stressed because you feel like it's just rapid fire questions.
Right.
But people that are comfortable slowing it down, saying, that's a good question. Let me think about that for a minute. And kind of pausing that, they tend to do a lot better. They have a lot more thought, and they think about, why am I asking the question I'm asking about?
Right. Because every question has a purpose for a
Right.
trait
It's
that you're
not just,
looking for. Yeah.
just to waste time and get through the material. Like, I really want to know. Maybe it's something obvious, like actually the question itself answers it, or maybe it's not. Maybe it's um, something that's obtuse. Like, if I want to see how you handle pressure, I give you a really hard clinical question to answer. But I don't actually care about your answer to the clinical question. I care about how you deal with the stress of being asked.
How you respond. Right. Right.
So one of the other things in the ER that I would look for is if people were decisive. And so I would give them um, 3 dice, different shapes, different colors, and I would tell them, pick one.
Just to see what they do.
And so I don't actually care what dice they picked. I just wanted to see how long it took them to pick one.
Right. But some people think that you care is like a test.
Right. And so they're like, I don't know.
Yeah.
But I just want to know if they're decisive. Like, I like pick this one, and that's why. And they're like, because it's green. Green's my favorite color.
Right.
Okay, perfect. That's a great answer.
And did you have a grading system after interviews that allowed you to rank the different applicants? Yeah.
So I would look at all of the characteristics that I would like, and then I try to get a question that answers each one specifically, and then I would have a specific rubric for their answers and how they would do. And some people answered way better than I would expect. Like, some people's depth of knowledge was probably better than mine.
Right.
But I wasn't necessarily looking for the depth of knowledge. Maybe I'm looking for their ability to be clear, or to be decisive, or these other things that maybe their skills in conflict management, things like that.
Okay. So practice, knowing why you're being asked questions, and it's usually for a trait.
Yeah, and so generally you have to have the mindset to slow down enough to think, why are they asking that question? What are they trying to get at?
Right, because it's not just it's not random. Okay, specific. Okay. Next thing, how does the match process work on you guys' end? Yeah, just like speak to that a little bit.
Right. So we talked about ERS a little bit. Is that everybody applies to ERS, and once all of the criteria by the program have been met, then the application gets forwarded. So each program determines that criteria. So if they want 15 letters of recommendation, that's what that's what they say.
And they wouldn't even see it if you don't meet that.
Right. And other programs are different. Maybe they only want 2. Right. That's fine. and so we're going to get all these applications, and generally that's how we spend
Hmm.
Thanksgiving break is reading applications
Right,
and
right,
deciding
right.
um,
Hmm.
who are we going to interview. And obviously we look at board scores. We look at all different things. You know, I like looking at do they know more than one language?
Hmm.
You know, all different things. So um, research is great, but it's not the end all be all. That's in and of itself doesn't get you an interview. So I want to see people that are well rounded. That again, that I could hang out with in the middle of the night and it'd be fun
Hmm.
to talk to.
And you think research wasn't as big for you being in emergency medicine, or you think in general it probably doesn't weigh as much as people think?
No,
Hmm.
because actually the opposite is because everybody has research.
Mm.
So it's very unusual um, not to.
Okay.
So at
So it
least
doesn't.
somebody, some,
Right.
um, and so again, that's part of everybody's trying to stand out, but by doing so, they
Nobody
feel a
stands out
very
there.
good group.
Yeah.
Yeah.
Okay.
So we would look at at all the applications. We decide who we're going to interview, and we would send out invitations.
Hmm.
When they would, I loved having in-person ones. There for a
Okay.
few years, we couldn't have in-person, and
Yeah.
that was a lot harder.
Right.
But I like in person because we kind of got to see what they're like in real life when they're hanging out, having lunch together.
Yeah.
You know, are they chatty or are they more withdrawn and by themselves? And
Hmm.
you know, again, we're looking for someone who fits in with our current group.
Right.
Um, that the residents will think, okay, I can
Hmm.
work with this guy. I can teach him. You know,
Right.
kind of thing.
Right.
Um,
And you said residents' opinions had a lot of weight
they
for that
do.
same reason, right?
And
Hmm.
the program coordinator also has huge
Hmm.
sway. They have absolute unquestioned veto power.
Hmm.
So if anyone ever was rude to the program coordinator, if they told me, they were no longer invited to anything. They were done.
Right.
And so there was no questions asked, even if
Hmm.
they were like had the best board scores or anything like that. So never, ever be rude to any of the staff because that is a quick way to get uninvited to everything.
Right. Right.
Um,
Okay.
so we would bring them in and we would interview them and we would interview them one at a time. And
Hmm.
again, I did it intentionally create stress, not because I didn't like them,
Hmm.
but because I need to see how they handled stress.
Right.
And then, but generally we would do this on our didactic day. And so during didactics, they're having fun, they're interacting with each
Hmm.
other, they're interacting with the current residents. And so
Right.
they get to see, am I a good fit here too? Because it really is a two-way thing, kind of like the 3 year marriage I talked about.
Yeah.
Like if
Yeah.
they're not going to be happy,
Yeah.
we
You
don't
know.
want them
Yeah.
there. We
Right.
because they're going to be miserable.
Right.
Nobody wants that, right?
Right. Right.
So it really is a both way um,
Hmm.
kind of thing. If they feel like, man, I'm just desperate to get a residency spot, they may make really hard choices that are not
Hmm.
going to they're not going to be
Right.
happy. And if
Wouldn't
they're
make
not
them
happy,
happy.
they're not
Hmm.
going to do
Right.
well.
Right. What do you think about sending emails, like follow-up emails,
Yeah,
interest emails? Was
perfect,
that
perfect.
effective? Do you guys ever see it? What?
No,
Mhm.
I think it was effective. I think it was good. We didn't necessarily say, "Aha!" They sent an email, you know, give them a point, that kind of
Hmm.
thing. Um, but it did probably have a soft sway of opinion.
Okay. And how would you say, what is the best way to approach if somebody was going to send an email?
Mhm.
What would you say?
So you know what I think probably held the biggest sway
Hmm.
is when people sent an email to the program coordinator. So
Mm.
not to me, but to the coordinator saying, "Hey, you did a great job. It was super organized, and I appreciate
Mm.
being there. Thank you."
Right. Right. And then
That
the coordinator would
that
tell
right
them.
that held
Right.
a big sway on the on how the coordinator um, favored someone. And again, they have sway. So the
Right.
nurses have sway. Everybody has sway.
Okay.
So you
Okay.
can't while you're there.
Yeah.
You need to be yourself and relaxed and fun. But boy, don't be mean spirited
Yeah.
because it's gonna stand out fast.
All right, be respectful to everybody.
Yeah.
Okay, before we wrap up, any final tips to anybody that might be, well, now is interview season. Any final tips for anybody applying?
Yeah. So it's hard if you can group them together geographically. That's
Hmm.
nice, but
Hmm.
because otherwise things get really expensive trying to travel all over the place,
Right.
um, and that's hard. One of the best things though is if you're a student is to do a rotation um, in the specialty you want to. The more rotations you can do as a student and get exposure to residency programs. So don't just do um, like a rotation in a community emergency department.
Right.
Do a rotation in an emergency department that has a
Residency
residency.
program. Right.
So you can learn from the residents as well as maybe get exposure, and because a known quantity or a known candidate is better than an unknown one.
Mm.
So sometimes if somebody looked great on paper and somebody I knew them well and they were
Mm.
medium, I would actually take the person
Because
that
you
was
know them at
medium
least,
rather
right?
than the unknown that looked
Uh,
great on paper.
I see. Okay.
So again, FaceTime counts.
Yeah, FaceTime. I like that. Okay.
Yeah.
Maybe we can end on that one. Dr. Saint Amour, thank you.
Thank you.
Thank you. All right. Perfect.